Hey there, welcome back to the channel. If you're gearing up for retirement or just want to decode how Medicare and Social Security work together, you're in the right spot. Today, we're tracking it all, how Medicare ties into Social Security, premium deductions, the scoop on Medicare Advantage, and Part D. And the drama that unfolds when Medicare, Social Security stops sending checks because someone, my mom, didn't update her address. Been a bureaucratic circus, but we made it through. Stick around and I'll share how we fixed it. Let's dive in. There's a lot to unpack. First of all, let's talk about how Medicare is tied to Social Security. You may have heard that Medicare is available to most people when they turn 65. But did you know that Medicare and Social Security, they're connected? And here's how. Medicare is the United States government health insurance program for people age 65 and older, and it's closely linked to Social Security. If you already have or is receiving Social Security benefits, by the time you turn 65, you will automatically enroll in the Medicare. If you're already receiving Social Security benefits by the time you turn 65, you'll be automatically enrolled in Medicare, which means that you'll get your Medicare card in the mail about 3 months before your 65th birthday. But hey, information like this gets updated now and then, so don't forget to check in with Medicare and Social Security for the latest, because nothing says fun like staying on top of government update. And so what if you're not yet receiving Social Security? Well, you can still sign up for Medicare on your own. It's just important to do so during your initial enrollment period. This is important. And that enrollment period, it begins 3 months before your 65th birthday and lasts 7 months in total. And if you haven't done it already, create a Social Security online platform for yourself. If you delayed enrolling in Medicare without a special reason, like still being covered under an employer's insurance, you might face penalties. So don't miss the window. Even if you don't need the benefits or Medicare, it's really important to check in with Social Security. Here's one of the most common questions I get. Does Medicare come out of Social Security check? And the answer is yes. And let's break it down. If you're on Social Security, your Medicare Part B premium covering things like your doctor's visits, any management of your chronic diseases, gets automatically deducted from your monthly check. In 2024, the standard premium is $174.70. But if your income takes a leap, so does your premium. Well, case in point, my parents sold their house this year, and bam, Medicare decided they need more for Part B. Now, if you're not receiving Social Security, let's say you're still working and haven't started your Social Security benefits, then Medicare Part B premiums won't be deducted from your check. Instead, you'll pay the premium directly to Medicare, either through monthly bills or automatic payments from your bank account. Additionally, if you're enrolled in Medicare Part D, covers prescription drugs, you'll also have a separate premium which might be deducted from your Social Security or billed directly depending on how you enrolled. Here I'm showing a brief description of the difference between Medicare Original and Medicare Advantage plans. All right, now let's dive into Medicare Advantage and what that means for your coverage. If you are familiar with the basics of Medicare, you have probably heard of Medicare Advantage, also called Medicare Part C. What exactly is it and how does it work? So Medicare Advantage is the alternative to original Medicare, Parts A and B. And it's offered by private insurance companies that are approved by Medicare. These plans cover all the services that original Medicare covers, but they often include extra benefits like vision, dental, and hearing coverage, things that Medicare Part A and B does not cover. And in the future, I'll dive deeper into the showdown between original Medicare and Medicare Advantage in another video. And trust me, the differences might surprise you and you could be swayed about your choice and what to choose. So hit that subscribe button and stay tuned. Now for Medicare Advantage plans, these include prescription drug covered, which means you don't need to necessarily sign up for a separate Part D plan. And that's in the case of my parents. They have Humana, which is a Medicare Advantage plan. With Medicare Advantage, you still pay your Part B premium, but the plan itself often comes with lower premiums and out-of-pocket costs than your original Medicare. Well, what's the catch? You probably need to stick to a network of doctors and may need referrals to see specialists, kind of like needing a hall pass for your healthcare. Very much similar to if you're in the Medicare Advantage with Kaiser Permanente. Well, what's the big win with Medicare Advantage? It is a one-stop shop. Hospital stays, doctor visits, prescription drugs, all bundled into one neat package. If you are still about simplicity, this could be the plan for you. So if you like the idea of having all your coverage in one place, Medicare Advantage might be a good option. So in the case of my parents, they have Medicare Advantage. So they pay a premium with Humana for their dental and their vision. Now, because Medicare Advantage private insurers work with Medicare, their Medicare payments, their premiums, which is tied also with Part D, are automatically deducted from their Social Security benefits. So that's something to consider, and that's why some people opt for the Medicare Advantage, because it's a lot simpler than handing the hospital your Medicare card and not have dental and vision. Okay, now let's talk about Medicare Part D prescription drugs. If you have original Medicare or Medicare Advantage plan that does not include prescription drug coverage, you'll need to sign up for Part D to get help with prescription medications. So if your choice is to stick with the original Part A and Part B, the original Medicare, then you need to also separately enroll in Part D. And those premiums will be deducted automatically from your Social Security benefits unless you choose to pay separately. So Medicare D is your go-to for prescription drugs, offered by private insurance companies approved by Medicare. Think of it as your pharmacy savings buddy, but with a catch. Each plan has its own list of covered meds or formulary list. So you'll want to double check that yours make the cut. So something to add when it comes to Part D prescription drug is that if you sign up with a Medicare Advantage insurer, they will go over all the different medications you're on. And with these insurers, for example, Humana, for my parents, recently I helped my dad enroll in his 2025 enrollment. And so the rep from Humana went over the list of medication, explained that with Humana, there are 4 categories of where the medication fits. If the categories for 1 and 2, those are common medications and they tend to have a lower copay. With more complicated medications like cancer drugs, they could be on a tier of category 4 or even 5. And those medications tend to not be either covered or the copay is higher. So those are things to check when you're ready to enroll and see if your Medicare Advantage plan, what kind of drug plan do they have, and when they work with the Part D of Medicare, are all the drugs that you're using covered through Medicare Advantage? So now that we talked about Part D, so let's talk about the monthly premiums, because there's a monthly premium which might vary by plan. But wait, there's even more. If you're earning the big bucks, Medicare hits you with an extra fee called an income-related monthly adjustment amount. Because who doesn't love paying extra to the government? Let's address a question some people have. Do you have to have Medicare once you turn 65? Well, technically no, but it's important to understand the implications of opting out because there's a penalty involved. You aren't required to enroll in Medicare when you turn 65 if you're still covered by your group health plan through your job or your spouse's job. But if you don't enroll in Medicare when you're first eligible, you could face penalties down the line when you do sign up later, especially for Part B and Part D, because those are the premiums that you'll be paying. And those penalties can add up. So if you're working or covered by an employer plan, it's really important to understand how your health insurance works with Medicare. Now, here's a situation that can be a real headache. What happens if your Social Security checks stop being deposited because you forgot to update your address with Social Security? And this is exactly what happened to my mom. So let me explain. If you change your address and forget to update it with Social Security Administration, your checks may stop being deposited to your bank account. In my mom's case, it was stopped. Well, this can cause delays in receiving both your Social Security benefits and your Medicare card. Now, if you call Social Security, they may say, well, it's easy to fix. Just update your address online or by phone or in person, and your payments will resume like clockwork. Actually, not quite. There's a lot of hoops that you have to go through. And given that it is a federal plan, there tends to be a lot of misinformation or incomplete information. Here's the scoop. My dad updated his Social Security address in 2019. My mom didn't. And fast forward to October of this year, she couldn't fill a prescription at our usual pharmacy. When I called to check, they told me she no longer had Medicare Part D. And that's where we started calling Social Security and Humana and found out that essentially her address was not updated at all. So it turns out her plan was dropped for non-payment. Oh, and here's the kicker. They said we couldn't enroll her for the 2025 plan either.
No way.
Well, so much for the easy fix, right? Well, that's not all. The plot thickens. Medicare premiums are supposed to be deducted from Social Security check. So I asked my mom if she's been getting her checks. Of course, she said. Well, spoiler alert, she wasn't, because she wasn't checking her statements. And she just thought because it's being deposited for these number of years, that of course it's being deposited. I take my parents to the nearest Social Security office. And after a soul-crushing 3-hour wait, we finally get called. And turns out my mom's address hadn't been updated since 2001, when flip phones were cool, I bet. Because of this, Social Security stopped depositing her checks in 2024 of April. And with those payments, Medicare hit the pause button too. They promised that once the checks were sent to her bank account, Medicare would magically reactivate, emphasizing magically. Well, not so fast. After the deposits did come through, I called Humana to re-enroll her in the 2025 Medicare Advantage. Well, instead of a straightforward fix, they directed me to their loss of entitlement department. Sounds ominous, doesn't it? That led to another trip to Social Security, our third, if you're keeping score. This time we had to fill out a form explaining why her Medicare was deactivated. Social Security would then notify Medicare to flip that switch back to active. I think the moral of the story is that bureaucracy is a marathon and not a sprint. And you better bring snacks or something to read, because it's a long wait and a lot of information, a lot of misinformation that you'll be receiving. At this time, there's a total of 3 visits to Social Security to not only reinstate my mom's Social Security benefits and the checks being deposited to her bank account, but also to let the Medicare system know that she wasn't not paying, but because of the address change, they just stopped making the Social Security benefits. So Medicare indirectly thought there was no payment. So that needs to be cleared up, and it's still an ongoing problem. And we just have to wait, because apparently the change in the system could take up to 3 to 4 weeks. But it's it's an anxious period right now, because it's December and we are hitting the enrollment period. So we don't really have a clear picture of what's going to happen next year. But if we can't get Medicare to be active by end of this year, in 2024, then next year, what probably may happen is my mom has to now accept the original Medicare, and she may have missed the window for the Medicare Advantage, and thereby having to purchase a dental and vision insurance separately. But you know, that things happen, and that's where we're at right now. All right, listen up. If you change your address and your Medicare card or your Social Security payments go MIA, missing in action, don't just sit there wondering, where did it go? Time to spring into action. The last thing you want is a gap in your coverage, especially your medical coverage. So make sure both Medicare and Social Security have your latest address, because the only thing you should be losing track of is your car keys and not your benefits. Well, let's sum it up. Medicare and Social Security are practically joined at the hip, and your Part B premium is usually deducted directly from Social Security check, because who doesn't love a good surprise deduction, right? You've got choices: original Medicare or a Medicare Advantage plan. And if you are in need of prescription coverage, Medicare Part D is probably your best bet. Oh, and by the way, updating your address with Social Security is a big deal if you want to actually get your benefits. Who knew a simple address change could be so important? Unfortunately, my mom had to find out the hard way. And one advice I would give to my mom's generation, where they may have had their husbands control the finances, is to become more independent in terms of understanding their Social Security and their Medicare. At least the basic stuff, like making sure that you're receiving your benefits from Social Security. Well, everyone, thanks for watching. If this video helped untangle some of your Medicare and Social Security confusion, don't forget to like and subscribe, and share it with someone, like maybe your parents, who might still be lost in all the bureaucracy and paperwork. And if you have questions or thoughts, drop them in the comments. I promise I'm not too busy to read them.